Okay, good afternoon. I am Mohammed JINU Jasil, one of the OIT trainers working in Jamia International Academy. And today I am going to discuss regarding OIT writing module, Mr. Yalin Ma's letter. There is a lot of concerns in this letter, so we will be discussing in detail regarding this letter. So firstly, I will be going through the whole letter task, and later I will be highlighting the relevant data in this letter. Okay. So firstly we can go to just outlining the letter. That is, today's date is 05 April 2012, and you are Annie Smith, cardiac nurse at Prince Charles Hospital, Brisbane, and your patient is Mr. Yalin Ma, who underwent emergency cardiothoracic surgery on 31st March 2012. This is the basic outline of the letter. Next, we are moving to the writing task. Okay, in writing task, the informations include write a referral letter to Miss Susan Williams, the hospital social worker. So the letter is to the social worker. We are writing this letter to the same hospital social worker, and requesting her to see your patient before discharge to assist with. He requires assistance with accommodation, letters for university and Department of Immigration, and referral to programs for smoking cessation and weight loss exercise. So what are the things the social worker needs to do is Mr. Yalin Ma requires assistance and social support from the social worker with accommodation, letters for university and Department of Immigration, and referral programs for smoking cessation and weight loss exercises. So this is the writing task of the letter. Next, we are moving to the complete data in this letter. Okay. So the first heading is patient details, or date of birth 12 March 1980, and the nationality is Chinese. Marital status, he is single and no family in Australia. Next, international student on scholarship for masters in information technology. And the next subheading is medical and surgical history. We are writing to the social worker. So the social worker is not more dealing with medical and surgical history, because he doesn't have any idea regarding medical and surgical things and related to the medical terms and medications and all. So there is no much importance in this medical and surgical history. But still there are some of the data that is important in this letter, which includes, firstly they are saying no non-allergies, no previous surgery. The next point is reports high blood pressure since late 2010. I don't think so it is relevant, because the social worker is not going to deal with blood pressure and hypertension and all, and also with the medication. So the next thing is medications, that is he is on Panadine 40 for headaches. And the next point is alcohol use. He does not drink alcohol, and he smokes 5 to 6 cigarettes per day. The next thing is his weight is 105 kg and his height is 182 centimeter. And the last point in medical and surgical history is family history, that his father died of aortic aneurysm at age 44. So I don't think so there is any relevant in this family history, because the social worker is not going to do anything with the family history, or he is not going to do anything with that his father is died of aortic aneurysm at age 44. So there is no any importance in family history for this letter. And the next heading is 31/3/2012, and which includes first point, presented to Royal Brisbane and Women's Hospital with severe chest and back pain. So in this particular heading, no need of writing presented to Royal Brisbane and Women's Hospital and all. The relevant data is severe chest and back pain. And the next point is CT scan showed severely dilated ascending aorta and type A dissection. No need of writing the investigations to social worker, because the social worker is not dealing with the investigation studies. So the next point is transferred to Prince Charles Hospital in acute pulmonary edema on arrival. So again it is a medical term, so we are not supposed to write this acute pulmonary edema for social worker because he don't know, otherwise he is not dealing with acute pulmonary edema. Okay. And the next point is echocardiogram performed and showing aortic valve incompetence. Again it is a medical term, so no need of writing this aortic valve incompetence. And finally final point of this subheading is open chest surgery for repair of aortic aneurysm and aortic root replacement with mechanical valve. So this open chest surgery is an important point because it is not a medical term. It's just a term that used by all common pupils. So the social worker is more dealing with open chest surgery because we are not going to tell him regarding emergency cardiothoracic surgery and all. Okay. So the next heading is post-operation or post-operative period. During this period, the patient is hypertensive during post-operatively, and the second point is his blood pressure is stabilized by day 3. All these 2 points is not needed because hypertension and blood pressure, the social worker is not going to deal with this hypertension as well as this blood pressure. And the coming point is satisfactory post-operative recovery. That means he made satisfactory post-operative recovery, which means it has importance in this letter because the social worker needs to know he is making a recovery from his problem. Okay. So the next point is reviewed by physiotherapist, exercise program provided. It is a semi-relevant data. If you are not going to meet your word count, you can write this particular sentence because it doesn't has much relevant or importance in this letter. So the next point is started on warfarin therapy. Warfarin is a medication or it is a medicine. So the social worker is not going to deal with this warfarin. So it doesn't has any beneficial in this or necessity in this letter. And finally, cardiac outpatient appointment at 3 and 6 months post-operatively, which means Mr. Yalinma has a cardiac outpatient appointment at 3 and 6 months post-operatively. It is a relevant data because the social worker needs to know regarding the cardiac outpatient appointment. Okay. The next point is to be discharged on 9/4/2012. It is also a semi-relevant data that you can include in your letter when when you are not able to meet your word count. Okay. Next we are moving to the next subheading, that is plan. In plan it includes routine wound care, patient education on warfarin therapy, monitor BP to be maintained at 120/80 or below. All these things are not relevant because the social worker is not going to deal with warfarin therapy education as well as he is not monitoring BP. So, and he is also not doing any sort of wound care for the patient. So, it is not a relevant data. It is a non-relevant data. Okay. So, next we are moving to the social history or social background. It is the most important thing in this letter. Okay. So, in social history, first point is mother has came to Australia originally from China. She is first time in Australia and now English, which means she has English communication barrier. And the next point is his lease on rental accommodation has recently expired. Kindly note this point. His lease on rental accommodation has recently expired, which means his rental accommodation agreement has expired. The next point is he will not complete this semester's university assessment on time, which means at the exact time he will not able to complete his semester university assessment. And the next point is his visa also expires at the end of semester, which means his visa is going to expire at the end of this semester. And the final point of the social background or social history is concerned about being able to lose weight and stop smoking. As you know, we already mentioned that he has a habit of smoking 5 to 6 cigarettes and his weight shows 105 kg. He is concerned about being able to lose weight and stop smoking. Okay. So these all are the informations in this letter. Next, I am going to highlight the relevant data in this letter. Okay. So first we are going to the today's date. It is 05 April 2012, which means 05/4/2012, and you are Annie Smith. Annie Smith is an important point because she is the nurse who is writing this letter, cardiac nurse at the Prince Charles Hospital, Brisbane. And the next important point is the patient name, Mr. Yalin Ma. And next we are moving to the patient details. Date of birth 12 March 1980. Since there is no age mentioned in this letter, this date of birth has a lot of importance, and if there is date of birth in this letter, if you see date of birth in any of the letter, date of birth is most important rather than age. The next one is Chinese. He is a Chinese international, so it is an important point. And about his marital status, no family in Australia is an important point. And is an international student on scholarship for Masters in Information Technology. While moving to medical and surgical history, he smokes 5 to cigarettes per day and his weight is 105 kg. While moving to 31/3/2012, presented to Royal Brisbane and Women's Hospital is not needed in this letter. Instead, you can write he presented to hospital with severe chest pain and back pain. So, severe chest and back pain is an important point. And the final point, open chest surgery. That particular word is important because the social worker is more dealing with he will be getting a good clarity while you are saying open chest surgery rather than emergency cardiothoracic surgery, because he doesn't have any idea regarding the medical terms. So you can use open chest surgery instead of emergency cardiothoracic surgery. Okay. Then next we are moving to post operation. In this heading you can write satisfactory post operative recovery and cardiac outpatient appointment at 3 and 6 months post operatively. These two are the relevant data. And reviewed by the physiotherapist exercise program provided is a semi relevant data, and also to be discharged on 9/4/2012 is also a semi relevant data, because I already mentioned you that if you are not meeting the exact word count, you can use these two data in your letter. Okay. Then while moving to plan, there is no important point in this plan, because all are related to the medical terms and medication. So the social worker will not he doesn't have any role in plan. And finally we are moving to the social background or social. In this, all points are very, very important in this letter, because he is dealing with all these things, and all these things is the essential thing that the social worker needs to do for Yalin Ma. So the social is an important heading, as well as the points in the social is very, very important in this letter. So these all are the important data that you need to include in this letter. Okay. So we can move to letter. Firstly, you are going to write the address of the recipient, that is in the writing task, to like Miss Susan Williams, Hospital Social Worker, Prince Charles Hospital, Brisbane, and today's date is 05 April 2012, and dear Miss Williams. So next we are writing this, you are offering Mr. Yalin Ma, and his date of birth is 12 March 1980. Next we are moving to the purpose or the introduction paragraph of this letter, that is Mr. Yalin Ma is a post-surgical patient for heart disease. He requires your social support and assistance in accommodation, since his rental agreement has recently expired. So his rental agreement has recently expired. That's the main thing the social worker needs to do immediately. So while moving to the social background, you can see that all other things like his lease, he will not complete this semester university assessment on time, which means there is time to do this particular thing for the person. And the next one is his visa also expires at the end of semester, which means there is time to do this visa. And the main important thing that the social worker need to do is his lease on rental accommodation has recently expired, which means he requires assistance in accommodation because he doesn't have any accommodation facilities since his accommodation has recently expired. So the most important or immediate thing the social worker needs to do is his accommodation. So that's why we are writing or we are including this point in the introduction paragraph. Once again, I am going to repeat this introduction paragraph, that is Mr. Yalin Ma is a post-surgical patient for heart disease. He requires your social support and assistance in accommodation since his rental agreement has recently expired. Okay. So next we are moving to the first body paragraph. Mr. Ma is an international student from China on scholarship for Masters in Information Technology. So Mr. Ma is an international student from China on scholarship for Masters in Information Technology. And full stop. Initially, he conferred to hospital, which means he presented to hospital with severe chest pain and back pain. So we are writing his medical problem that he presented to the hospital, or he conferred to the hospital with severe chest and back pain. Consequently, he was taken up for the surgery since the heart disease was found on examination. So we are not writing any sort of examinations in this letter because the social worker is not going to be deal with any sort of investigation. So we are just mentioning that on examination the so and so things are confirmed. So that is the only thing needed in this letter. So once again I am just repeating that sentence. Initially he conferred or he presented to hospital with severe chest pain and back pain. Consequently, he was taken up for the surgery since the heart disease was found on examination. Full stop. The next sentence is post-operatively he has made progress. So he has made progress. So next sentence we are including that post-operatively he has made progress. Full stop. He is unable to complete his semester university assessment on time. In addition, his visa expires at the end of semester. Therefore, he requires guidance in writing letter to university and Department of Immigration. Once again, these things are connected from writing task and from the social background, that is post-operatively he has made progress and he is unable to complete his semester university assessment on time. He is not able to complete his semester university assessment on time. In addition, his visa expires at the end of this semester. Therefore, he requires guidance in writing letter to university and Department of Immigration. Okay. So this is the first paragraph. Next we are moving to the second paragraph, that is Mr. Ma's mother reached to Australia from China to take care of him. Mr. Ma's mother reached to Australia from China to take care of him. Look, we have just paraphrased this sentence. Mr. Mother has came to Australia urgently from China. First time in Australia, no English. This sentence is completely paraphrased to Mr. Ma's mother reached to Australia from China to take care of him. She is first time in this country and has language barrier. Okay. And the next point is he smokes 5 to 6 cigarettes per day and is overweight of 105 kg. This includes in the medical and surgical history, that is he has a habit of smoking 5 to 6 cigarettes per day and his weight is 105 kg. So So the next sentence is, therefore, comma, he requires a referral program for smoking cessation and weight loss since he is concerned about losing weight and stop smoking. So these three things like his habit of smoking and weight, along with he requires a referral program for smoking cessation and weight loss, and finally is concerned about losing weight and stop smoking. These three sentences are connected from different particular areas, like is a habit of smoking 5 to 6 cigarettes per day and is overweight of 105 kg is from medical and surgical history, and therefore he requires a referral program for smoking cessation and weight loss is from writing task, and finally he is concerned about being able to lose weight and stop smoking is from social background or social, it comes under the social history. So these three things are connected together to create this sentence. Okay, he smokes 5 to 6 cigarettes per day and is overweight of 105 kg. Therefore, he requires a referral program for smoking cessation and weight loss since he is concerned about losing weight and stop smoking. So next we are moving to the recommendation paragraph, since we already finished the second body paragraph. Okay. So the recommendation paragraph is, please note, he has a cardiac outpatient appointment at quarterly and half yearly. It is from this post-operation, it comes under the post-operation, the last point of the post-operation, that is cardiac outpatient appointment at 3 and 6 months post-operatively. It is completely paraphrased to this particular sentence, like please note, he has a cardiac outpatient appointment at quarterly and half yearly. You can also write in another manner, like kindly note, he has a cardiac outpatient appointment at 3 and 6 months post operatively. Okay, so the closing paragraph is, I am obliged to clarify any of your queries, and yours sincerely, Miss Annie Smith. So the name of the nurse who is writing this letter is mentioned in this area, that is Miss Annie Smith, registered nurse. So this is about Mr. Yalin Ma's letter. So I had covered every relevant information in this letter, and I hope you got a clear picture regarding this letter. So thank you everyone who is in this live for spending your valuable time with me and with Jamia International Academy. Thank you.